It's been incredible to watch the way the Talbot County Department of Social Services staff have adapted to the COVID environment and all the changes that brought down. That we moved employees out to telework for the first time in history for many of our programs. And that took a lot of adaptation, both in terms of adapting to working in a home environment with children or other individuals in the home, using technology to conduct work instead of being in the office to be with each other. I think from the public's perspective, the state was able to get a lot of permissions and waivers that helped the public while we went through collectively this experience over the last year. For example, our income support programs. Typically, when an individual wants to apply for some type of income support, like temporary cash assistance or supplemental nutrition assistance, they come into the office, there's an interview involved, they have to provide documentation, then those benefits are essentially renewed on a regular period of time. And the federal government allowed us to waive face-to-face interviews so that we could do any interview that was required over the phone. Benefits were automatically renewed so that the public was not worried about trying to get documentation of income and those kinds of things into the office. There were improvements made so that individuals could apply online. They can get in touch with us by phone. They can fax their applications to us. They can email them to us. So just like the rest of the world, we really depended on technology, not only to get our work done, but to give the public access to what we do. The Department of Social Services supported the county in distributing the CARES dollars to individuals in the community that were experiencing a loss of income because of COVID-19. That program got a slow start, but as we approached the end of 2020, we saw an incredible increase in the number of applications. And I will say that between the individual assistance and food assistance and the legal services that were funded using those CARES dollars, DSS, the county, the Neighborhood Service Center, St. Vincent de Paul, and Chesapeake Multicultural Resource Center got $750,000 into the community to meet individual emergencies, food needs, and other kinds of needs that the public had as a result of COVID-19. So it took a lot of partnership, a lot of hard work. We all had staff that spent many, many hours doing overtime and compensatory time to get this money into the community. It also took lots of, I think, creativity in getting the word into the community about the availability of this assistance. And we were working with segments of the population that had never had to ask for help before. So I think people have to hear that that money is available over multiple occasions before they actually feel comfortable coming in and taking advantage of that.
And when the pandemic hit, our advocacy center was located in the hospital, University of Maryland Shore Health. And we immediately had to change what we were doing and relocate. So we temporarily moved to a social services office as we couldn't access the hospital due to the pandemic. There's a lot of positive things that have come out of the pandemic. It's definitely been hard. Like Linda said, our multidisciplinary team, which consists of law enforcement, the nurses that do our sexual assault exams, our child protective services investigators, our family advocates, our state's attorney, they all adapted very quickly to start doing virtual meetings. They still continue to come face to face, even when the lockdown orders were in place, so that they could be here to help us assess that safety of those children. But then there's been a lot of things that were helpful. So we found virtual music therapy, and kids have loved that. And we really rely upon the community to help support programs like that. And I do feel like the pandemic and the relocation really highlighted we live in a really amazing community that rallies behind children that have experienced hard things.
One thing that we have learned about ourselves in this last year, along with the rest of the community, is that we are resilient and we can adapt to these changes. And that's what we do to continue serving the Talbot County community.